The TRANSCEND-CLL-004 study, it's a phase 1 study which we are reporting 16 patients on during this meeting, actually 23 patients, sorry, on this meeting, and across 2 dose levels. Patients needed to have failed 2 or 3 lines of therapy depending on their risk category of CLL, and they all needed to have failed BTK inhibitor like Ibrutinib. Half of them actually had failed venetoclax as well, so a pretty poorly behaving group of patients. We found that the overall response rate was as high as 75%, and complete remission rate was high as well, 68% or so. With high minimal residual disease rates in the 60 to 65% range, and all these the best responses happen pretty early in the treatment course, about a month after CAR T-cell therapy. And it seems like the patients we followed so far was 6 months, 9 months, and 3 patients are now out 12 months and more. Majority of them have stayed in a complete remission, so the results are looking pretty good and durable. Overall response rate's about 68% or so at 6 months, MRD undetectable, about 60% at about 6 months. So pretty good durability and response so far. So the phase 2 portion of the study is now ongoing, so we're expanding and we're adding more patients, of course, at the dose level 2 state. We did not find significant toxicities at either dose level, to be honest, which is why we went up to the dose level 2 to expand that, and we feel like the CAR T-cell persistence might be a little bit better at dose level 2, so we're expanding that, and we'll see when that phase 2 part finishes. We also have a second cohort in the phase 1 part, which is combining the liso-cel with Ibrutinib to see if we can enhance these responses even more. So far, with the monotherapy liso-cel in CLL, we've seen probably as good or better responses than other CAR T-cells have reported in combination with Ibrutinib. So it seems like a very promising agent in CLL.